Good day, this is Dr. Catherine Duque-Lee, and I'm here to discuss about health problems in rapid urbanization. At the end of the session, the student should be able to define urbanization and industrialization, briefly discuss common diseases of rapid urbanization such as injuries and accidents, substance use disorders, mental health conditions, pandemics and travel medicine, and health conditions secondary to climate change and disasters. Let's start with urbanization and industry. What is urbanization? Urbanization is the shift of population from rural to urban areas, or a change in the ratio of the total population living in the urban areas. It describes both the increasing footprint of urban areas and the increasing percentage of the urban population. This is closely linked with modernization, industrialization, and sociological process of rationalization. What is rapid urbanization? Urbanization is a social, economic, political, cultural phenomenon that occurs in an often unmanaged autonomous process when people individually respond to economic opportunities and social trends in ways that result in collective effects that are primarily defined by greater concentration of human activities and increased density of human settlements at a faster pace. As in your manuals, the urbanization process is due to two main factors or processes, such as migration into cities, mainly from rural to urban migration, and natural or internal population increase in the cities, probably due to excess number of births over the number of deaths. There are four phases of urbanization. In phase 1, this is the initial stage, which is an agricultural or primary production phase. Phase 2 is the acceleration stage or industrialization phase, characterized by exponential growth of their urban population's growth. Third world countries such as the Philippines are usually in this phase. Phase 3 is the mature stage or post-industrial phase where urbanization starts to flatten up and stabilizes from its initial exponential growth in phase 2. Examples of this are northwestern European countries, USA, and Canada. Phase 4 is the final phase, and it is uncertain what will happen in this phase. But there are two scenarios that are likely to happen, such as urbanization will continue to increase until the country is 100% urbanized, such as what we see in Japan. Second scenario, large cities will lose their population and may witness decline in urbanization, leading to counter-urbanization or de-urbanization. Sadly, large Western cities like London, Paris, and Amsterdam are witnessing gross decline in their population. On the other hand, what is industrialization? It is a special case of near universal phenomenon of human trade and economic exchange after the migration from rural areas. It refers to a period of marked intensification of such activities, which in all known cases has resulted in an irreversible change in a country's economy, after which the production and international trading of commodities remains permanently at a much higher level of intensity. there are positive effects of industrialization on healthcare delivery. First is easy access of health services through good infrastructures like roads. They provide transportation to individuals in the healthcare facilities and to the healthcare practitioners. Next, we have industrialization has led to provision of essential machines such as defibrillators, electrocardiograms, suctioning machines, those machines that you use for diagnosis and for treatment of patients. Next, we have it enhances research and study of different health hazards. Through industrialization, history of diseases is documented more efficiently, and this may aid in future research on factors affecting health and healthcare deliveries. Next, we have enhancement of better communication. So through development of industrialization, there is good communication that is developed between healthcare providers and their colleagues, and also with their other individuals in the society and healthcare delivery system. On the other hand, there are negative effects of industrialization on health and healthcare delivery. Because of urbanization, this has led to migration of people from rural areas to urban regions, leading to overpopulation and overcrowding, thus resulting to poorer health practices due to congestion and development of slums. So, individuals are more susceptible in contracting diseases which results from overcrowding. Next, we have pollution. So, due to rapid industrialization and more building of industries, pollution in rivers and waters, as well as release of smoke to the atmosphere, can lead to a number of diseases, such as cancers and respiratory diseases. Next is the spread of disease. So, as we said, overpopulation in urban areas has led to the spread of disease. For example, cholera, tuberculosis, and all other diseases of which are transmitted to direct contact, probably airborne or waterborne transmission, leading to deterioration of health to individuals. Lastly, industrialization has led to emergence of social class and corruption. So this has led unfair distribution of resources among healthcare facilities, thus affecting the healthcare delivery. Individuals with low status in society are not able to access healthcare facilities with well-equipped or high-quality diagnostic equipment, which may translate to the provision of poor quality healthcare and inequitable health delivery. Here are diseases associated with rapid urbanization: injuries and accidents, substance use disorders, mental health conditions, pandemics and travel medicine, and health conditions secondary to climate change and disasters. So we will touch on them briefly, as you have already taken up substance use disorders and climate change in your past modules. Let's talk about injuries and accidents. So for injuries, according to the World Health Organization, injuries and violence take the lives of 4.4 million people around the world each year and constitute nearly 8% of all world deaths. Tens of millions of people suffer non-fatal injuries as well each year, which lead to emergency department and acute care visits, hospitalizations, and treatment by general practitioners, and often result in temporary or permanent disability with the need for long-term care and rehabilitation. For people aged 5 to 29 years, three of the top five causes of death are injury related, namely road traffic injuries, homicide, and suicide. The risks associated with road traffic collisions and violence are greatest in low and middle income countries such as the Philippines. The common cause of injury deaths would include road traffic injuries, falls, drowning, burns, poisoning, product-related injuries, violence, and suicide. The cause of injury deaths in 2019 globally showed that road injury is the top killer for 2019, followed by falls, self-harm, and other intentional injuries. In road traffic injuries, worldwide there is an estimated 1.3 million people who are killed each year in road traffic crashes, and as many as 50 million more are injured. Projections indicate that road traffic fatalities will be the fifth leading cause of death by the year 2030 unless urgent action is taken to address the issue. Again, in many low and middle income countries, traffic laws are inadequately enforced. This may be due also to the traffic mix, which is more complex than that in high income countries, and usually involves 2, 3, or 4-wheeled vehicles, animal-drawn vehicles, and other conveyances, plus pedestrians, all sharing the same road space. So the road may be poorly constructed and maintained, and road signs and lightings are usually inadequate, and driving habits are poor in these low and middle income countries. So road traffic injuries are the leading cause of death among Filipinos 15 to 29 years old and a major killer among children. Next, we have violence. Of the approximately 600,000 murders each year, sadly, more than 90% occur in low and middle income countries once again, probably poverty-driven. So for every murder, scores of people sustain non-fatal injuries requiring medical attention, and hundreds experience more insidious forms of violence and abuse, leading to long-term physical and mental health consequences, behavioral disorders, and even social problems. In our country, there is what we call the Anti-Violence Against Women and Their Children Act, or the VAUSI law. It is also called the Republic Act No. 9262 of 2004 and was established to protect women and children from all forms of violence. It is an important legal framework that aims to ensure the safety and security of women and children in the Philippines. This law defines violence against women and their children as any act or a series of acts that result in physical, sexual, or psychological harm or suffering, economic abuse, and threats of such acts. What is whose response? They are involved in developing and disseminating guidance for countries on evidence-based policies and practice. So they have come up with guidance such as the Save Lives, a road safety technical package, preventing drowning, an implementation guide, step safety, strategies for preventing and managing falls across the life course, Violence Prevention, the Evidence. Inspire, 7 Strategies for Preventing Violence Against Children. Respect Women, Preventing Violence Against Women. Live Life, Suicide Prevention Implementation Package. And Safer, a world free from alcohol-related harms. They are also involved in monitoring progress towards achieving the Sustainable Development Goal targets linked to injury, violence prevention, mental health, and substance use. They are also providing technical support to countries through programs such as the Bloomberg Initiative for Global Road Safety and the Global Partnership to End Violence Against Children. They are also involved in clarifying the role of ministries of health as part of multisectoral injury prevention efforts as reflected in Preventing Injuries and Violence, a guide for ministries of health. We go now to substance use disorders. The DSM-5 now combines the substance abuse and substance dependence criteria into one order called substance use disorder, or commonly called as drug addiction. So let us define 2 important terms when it comes to substance use disorder. First is tolerance, which is defined by either of the following: a need for markedly increased amounts of the substance to achieve intoxication or the desired effect. Second is markedly diminished effect with continued use of the same amount of the substance. Next, we have withdrawal, which is manifested by either of the following: the characteristic withdrawal symptoms for the substance, or the same or closely related substance is taken to relieve or avoid withdrawal symptoms. Here are the categories of substance abuse on DSM-5. We have alcohol-related disorders, caffeine-related disorders, cannabis-related disorders, hallucinogen-related disorders, inhalant-related disorders, opioid-related disorders, sedative or hypnotic-related disorders, stimulant-related disorders, tobacco-related disorders, or this is your common smoking, unknown substance disorder, and even your gambling disorder. So there are the other disorders recommended for further study in section 3 of the DSM-5, and we are probably guilty of this. First, we have the caffeine use disorder. So it requires that all 3 of the most clinically meaningful indicators of distress or impairment associated with caffeine dependence must be fulfilled. So persistent desire or unsuccessful efforts to cut down or control caffeine use, continued caffeine use despite knowledge of having a persistent, recurrent physical or psychological problem that is likely to have been caused or exacerbated by caffeine, and characteristic caffeine withdrawal syndrome or caffeine use to relieve or avoid withdrawal symptoms. Next, we have the internet use disorder, and this is a broad term which describes an impulsive control disorder characterized by spending excessive amounts of time on the internet, probably on dating sites, scrolling through social media, playing online games, and even watching YouTube videos or reels. Lastly, we have neurobehavioral disorder associated with prenatal alcohol exposure, and this is probably due to the increased number of young women taking alcohol. Here are the usual clinical manifestations of substance use disorder. There is a feeling that one has to use the drug regularly, daily, or even several times a day, having intense urges for the drug that block out any other thoughts over time, needing more of the drug to get the same effect every day, taking larger amounts of the drug over a long period of time than usually intended, making certain that one maintains a supply of the drug, spending money on the drug even though she or he cannot afford it anymore, not meeting obligations and work responsibilities, or cutting back on social or recreational activities just to have the drug use. Continuing to use the drug even though one knows it is causing problems in her life or causing the person physical or psychological harm. Doing things to get the drug that one normally would not do, such as stealing, driving, or doing other risky activities when the person is under the influence of drug. So it can go as far as being violent or even murder. Spending a good deal of time getting the drug, using the drug, or recovering from the effects of the drug. Failing in his or her attempts to stop using the drugs. And finally, experiencing withdrawal symptoms when one attempts to stop taking the drug. Here are usual signs and symptoms to recognize unhealthy drug use in family members. Usually, the patient has problems at school or work, frequently missing school or work, sudden disinterest in school activities or work, or a drop in grades and work performance or increased absences. Next, we have physical health issues. So usually there is lack of energy and motivation than usual. There is weight loss or weight gain in a short period of time, or usually the patient presents with red eyes. Next, we have neglected appearances. So there is lack of interest in fixing oneself, in hygiene, in grooming. So changes in behavior, there is exaggerated or under efforts to bar family members from entering his or her room, or being extra secretive about where he is or who she goes out with, or some drastic changes in behavior and in relationships with family and friends. Lastly, they usually have money issues. So sudden requests for money without a reasonable explanation, or discovery that money is missing or has been stolen, or that items have been has disappeared from the house where they usually were, indicating maybe that they are being sold to support the drug use. So there are these common drug addictions. First, we have the usual marijuana, hashish, and other cannabis-containing substances. We have K2 spice and bath salts, or what we call the synthetic cannabinoids. Usually they are sprayed on dried herbs and then smoked, but can be also prepared as herbal teas. So substituted cathinones, also called bath salts, are mind-altering substances similar to amphetamines and ecstasy or cocaine. Next, we have barbiturates, benzodiazepines, and hypnotics. These are actually prescription central nervous system depressants, which are often used and misused in search of relaxation or desire to switch off or forget stressful thoughts or feelings. Next, we have stimulants, which includes amphetamines, methamphetamines. So this is your shabu, cocaine, and other amphetamine such as dextroamphetamine. So they are often used or misused in search of high or to boost to boost energy, to improve performance at work or school, or to lose weight or control appetite. So next we have club drugs, which are commonly, of course, used as clubs. So this example of these are party drugs such as ecstasy or your MDMA, your gamma hydroxybutyric acid or your GHB, and others such as ketamine. Next, we have use of hallucinogens, which can produce different signs and symptoms depending on which drug used. So the most common hallucinogens are the LSD and the PCP. So as for the inhalants, commonly inhaled substances include rugby, your glue, your paint thinners, your correction fluid, the felt tips of your markers. There's that odor there, gasoline, cleaning fluids, acetone, and aerosol products. Lastly, we have opioids. They are pain-killing drugs produced from opium or made synthetically. So this class of drugs includes heroin, morphine, codeine, methadone, and oxycodone. And on to the third, we have the mental health conditions. So what is mental health? Mental health is more than the absence of a mental disorder. It is actually a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It is actually recognized as a basic human right, and it's an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health conditions include mental disorders and psychosocial disabilities, as well as other mental states associated with significant distress, impairment in functioning, or risk of self-harm. So the common ones would be your major depression disorder and your anxiety disorder. So poor mental health and mental illness are sometimes they are used interchangeably. However, these terms are not the same. An individual without a mental illness diagnosis may experience poor mental health. Likewise, an individual with mental health illness can experience periods of good physical, mental, and social well-being. So it is crucial to delineate and establish these terms, as there are numerous factors that influence any individual to experience poor mental health even without clinical diagnosis and regardless of their general well-being. In terms of mental health burden, around 20% of the world's children and adolescents have a mental health condition, with suicide the second leading cause of death among 15 to 29-year-olds. Approximately 1 in 5 people in post-conflict settings have a mental health condition. According to the DOH in 2020, at least 3.6 million Filipinos are facing mental health issues, which includes depression, substance use, and mood disorders. From 2020, there was a marked increase in suicide rates by 53.7% in 2021. And suicide prevention is a global priority and included in the Sustainable Developmental Goals. It is best to always rule out suicidal ideation whenever you speak or consult a patient with mental health issues. The World Health Organization has come up with a comprehensive mental health action plan of 2013 to 2030. So it aims to improve mental health by strengthening the effective leadership and governance, by providing comprehensive, integrated, and responsive community-based care, by implementing promotion and prevention strategies of mental health, by strengthening information systems, evidence, and research in mental health. In the Philippines, we have the Mental Health Act, or the Republic Act 11036 of 2018. This act seeks to establish access to comprehensive and integrated mental health services while protecting the rights of people with mental disorders and their family members. So, implementation of rules and regulation aims to design a community mental health program, to build a human resource capacity for mental health, and to strengthen overall mental health and well-being services in primary, secondary, and tertiary healthcare facilities. The Medicine Access Program for Mental Health in 2019 was established to ensure that mental health drugs are available for the community to improve primary health care in the poor communities through provision of essential medicines for the prevention of these disorders. So the most commonly used antipsychotics in clinical practice are chlorpromazine and haloperidol, escitalopram, and fluoxetine, which are the most commonly used antidepressants in the clinics. So we have Lusog Isip app, and it's the first mobile app for mental health and self-care culturally adapted for the Philippines. And it's the most notable project by the DOH in collaboration with the USAID Renew Health Project. So it is the first application launch which aims to deliver evidence-based self-help tools such as workbooks or exercises, audio guides, journaling, mood tracking, self-care reminders, and etc. So it allows health professionals to reach individuals facing mental health issues who are in isolation. So because this started in the pandemic. So this is with the use of their mobile phones application. So if the user is not satisfied with the tools in the application, a list of other mental health services are also accessible within that app. So what are the mental health services in the Philippines? So Filipinos are unfortunately constrained from seeking health when experiencing mental health symptoms, and this is due to the mental health stigma. So it's still real. Data indicate that there are 0.52 psychiatrists and 0.07 psychologists per 100,000 Filipino inhabitants, and 0.49 mental health nurses per 100,000 of the population. Only 2 tertiary care psychiatric hospitals are present in the Philippines, and this is the National Center for Mental Health in Mandaluyong City and the Mariveles Mental Hospital in Bataan. So, psychiatry remains a lesser popular specialty for medical graduates in the Philippines, unfortunately. And the numbers being trained are inadequate to meet a growing need. So, this is further illuminated when compared with the World Health Organization, who recommended global target of 10 psychiatrists per 100,000 population. We move to the fourth, which is pandemics and travel medicine. So I'm sure you all know by heart the definition of pandemic. But who declares a pandemic when a disease growth is exponential and it has gone beyond borders of regions? So in being declared a pandemic, the virus has nothing to do with the virology, the population immunity, or disease severity. It means a virus covers a whole wide area affecting several countries and populations. So what is the difference between an endemic, outbreak, epidemic, and pandemic? As a review, when you say endemic, it is constant. It is just found in a specific location. And this is what probably your malaria in Palawan. When we say outbreak, there is a specific area within a time period, and it's just more number of cases than expected. Let's say we have your polio outbreak some years ago prior to pandemic, or the measles outbreak right after the dengue vaccine scare. Next, we have an epidemic. Its outbreak over greater area. And lastly, we have your pandemic, so which you are all now aware of for having experienced it firsthand. There are 6 phases of pandemic according to the WHO. In phase 1, no viruses circulating among animals have been reported to cause infections in humans. In phase 2, an animal virus circulating among domesticated or wild animals is known to have caused infection in humans and is therefore considered a potential pandemic threat. In phase 3, an animal or human-animal influenza reassortant virus has caused sporadic cases or small clusters of disease in people, but has not resulted in human-to-human transmission sufficient to sustain community-level outbreaks. So there is limited human-to-human transmission that may occur under some circumstances. For example, when there is close contact between an infected person and an unprotected caregiver. However, limited transmission under such restricted circumstances does not indicate that the virus has gained the level of transmissibility among humans that is necessarily to cause already a pandemic. In phase 4, there is a verified human-to-human transmission of an animal or a human-animal influenza reassortant virus that is able to cause community-level outbreaks. So the ability to cause sustained disease outbreaks in a community marks a significant upward shift in the risk of a pandemic. So any country that already suspects or has verified such an event should urgently consult with WHO so that the situation can be jointly assessed and a decision made by the affected country if implementation of a rapid pandemic containment operation. is already warranted. Phase 4 indicates a significant increase in risk of a pandemic, but does not necessarily mean that a pandemic is a foregone conclusion. In Phase 5, while most countries will not be affected at this stage, the declaration of Phase 5 is a strong signal that a pandemic is imminent and that the time to finalize the organization, communication, and implementation of the planned mitigation measures is short. In Phase 6, the designation of this phase will indicate that indeed a global pandemic is underway. So I hope you have seen this and applied it in our experience with COVID-19. Here are some notable pandemics in history. Starting with the Black Death. There was an estimated death of 25 million people across the world in the 14th century, and it lasted for a total of 7 years. It was caused by a bacteria called Yersinia pestis, and it just stopped being a pandemic when people practiced isolation and quarantine, and as well as observe hygiene. The American plagues of the 16th century was a cluster of European diseases brought to the American by European explorers. So, a sample of these were the smallpox. It was the chief illnesses of the American plagues, which contributed to the collapse of the Inca and the Aztec civilizations. So, the estimates suggest that 90% of the indigenous population in the Western Hemisphere was wiped out as a result of these plagues. The flu pandemic, the new transportation routes made possible in the industrial age made it easier for influenza viruses to spread in the US and beyond. So there were a total of 1 million people dead at its wake. So in the span of months, influenza traveled across the globe with the earliest cases reported in Russia. So the virus spread rapidly throughout St. Petersburg in Russia before quickly making its way through Europe and the rest of the world. The Spanish flu is an influenza pandemic popularly called the Spanish flu. And it immediately followed World War I. So in just a span of 2 years, over 50 million deaths were recorded during the outbreak. So this is one of the deadliest pandemics. The Asian flu from 1957 to 1958, it's a blend of avian flu viruses which began in China and eventually claimed more than 1 million lives. It was first reported in Singapore in February 1957 and Hong Kong in April 1957, and the coastal cities of the US in the summer of 1957. So a total death toll was more than 1.1 million worldwide, with 116,000 deaths nationally. Lastly, we have the AIDS pandemic and epidemic from 1981, unfortunately, until present. And it has claimed an estimated 35 million lives since it was first discovered. So, the virus that caused AIDS is likely to have evolved from a virus found in chimpanzees that was transferred to humans in West Africa in the 1920s. So, by the late 20th century, the virus had made its way around the world. So, for decades, the disease has no known cure yet, but medication was developed in the 1990s, and it now allows people with the disease to experience a normal lifespan with regular treatment, as if they just have a chronic disease such as hypertension or diabetes needing lifetime maintenance. And of course, lastly, the COVID-19 pandemic that we have all witnessed to. So the SARS-CoV-2, which has been detected in China in December 2019, has become and evolved into pandemic in March 11, 2020, where it was declared a pandemic in by the WHO. So the latest tally showed that 6.9 million deaths were recorded since it started. So in May 5 of 2023, WHO Emergency Committee on COVID-19 recommended that given the disease was well established and ongoing, it no longer fit the definition of the public health emergency of international concern. This does not mean that the pandemic itself is over, but the global emergency it caused is done for now. So now we go to travel medicine. So what is travel medicine? It's a medical discipline that deals with prevention of infectious diseases during international travel, as well as the personal safety of travels and the avoidance of environmental risks during travels. So here are travel-related risks. So the mode of transport, the destination, the duration and the season of travel, the purpose of travel, the standards of accommodation, the food hygiene and sanitation, the behavior of the traveler, and the underlying health of the traveler. Here are the routine vaccines that are recommended for travelers. The diphtheria vaccine, hepatitis B, Haemophilus influenza type B, human papillomavirus, seasonal influenza, measles, mumps, and pertussis, rubella vaccine, pneumococcal disease vaccine, poliomyelitis, rotavirus, tetanus, tuberculosis, and varicella vaccines. Here are selective vaccines for travelers, and it will depend on the destination of the traveler. Cholera, hepatitis A and E vaccines, Japanese encephalitis vaccines, meningococcal disease, rabies vaccines, tick-borne encephalitis vaccines, typhoid fever, and of course the yellow fever vaccines. Below are travelers with pre-existing medical conditions and special needs. So in age, air travel may cause discomfort to infants as a result of changes in cabin air pressure and contraindicated for infants less than 48 hours old. Infants and young children are particularly sensitive to sudden changes in altitude and to ultraviolet radiation. They have special needs with regard to vaccinations and anti-malarial precautions. They become dehydrated more easily than adults in the event of inadequate fluid intake or loss of fluid as a result of diarrhea or vomiting. Advanced age, however, is not necessarily a contradiction for travel if the general health of the elderly is good. Elderly people should seek medical advice before planning long-distance travel. Next is pregnancy. Travel is not generally contraindicated during pregnancy until close to the expected date of delivery, provided that the pregnancy is uncomplicated and the woman's health is good. So it is safest for pregnant women to travel during the second trimester. Next is disability. Physical disability is not usually a contraindication for travel if the general health status of the traveler is good. Airlines have regulations concerning travel for disabled passengers who need to be accompanied. Next, we have pre-existing illness. People suffering from underlying chronic illnesses should seek medical advice before planning a journey. Here are examples of existing illness: cardiovascular disorders, chronic hepatitis, chronic inflammatory bowel disease, chronic renal disease requiring dialysis, chronic respiratory diseases, diabetes mellitus, epilepsy, immunosuppression due to medication or HIV infection, previous thromboembolic disease. So patients in traveling through airplane has a higher risk of having deep venous thrombosis. Severe anemia, severe mental health disorder, any chronic condition requiring frequent medical intervention, transplantation, oncologic conditions, and chronic hematologic conditions. So, travelers with a chronic illness should carry all necessary medications and medical items for the entire duration of their journey. So here are some points on medical consultation before travel. So travelers intending to visit a destination in a probably developing country should consult a travel medicine clinic or medical practitioner before the journey. So this should take place at least 4 to 8 weeks before the journey and preferably earlier if long-term travel or overseas work. Consultation will include information about the most important health risks, including traffic accidents, and will determine the need for any vaccinations or anti-malarial medication, and identify any other medical items that the traveler may require. A basic medical kit will be prescribed or provided, supplemented, or as appropriate to meet individual needs. Dental or gynecological and age-appropriate examinations are advisable before any prolonged travel to developing countries or to remote areas. Travelers with underlying medical problems are strongly advised to consult a travel medicine clinic or medical practitioner to ensure that their potentially complex travel health needs are met. All travelers should be strongly advised to seek comprehensive travel insurance, and this is particularly important for people with chronic or recurrent health problems. Here are some contraindications to travels. Infants less than 48 hours old, women after the 36th week of pregnancy or 32nd week for multiple pregnancies, those suffering from angina pectoris or chest pain at rest, any active communicable disease, decompression sickness after diving, increased intracranial pressure due to hemorrhage, trauma, or infection, infections of the sinuses of the ear and of the nose, particularly if the eustachian tube is blocked, recent myocardial infarction and stroke, recent surgery or injury where trapped air or gas may be present, especially abdominal trauma and gastrointestinal surgery, craniofacial and ocular injuries, brain operations, and eye operations involving the penetration of the eyeball, severe chronic respiratory diseases, breathlessness at rest or unresolved pneumothorax, sickle cell anemia, and psychotic illness except when already fully controlled. Of course, the above list is not comprehensive, and fitness for travel should also always be decided on a case-by-case basis. That is why it is important to have your medical consultation prior to air travel. This is the CDC Yellow Book, Health Information for International Travel, and it is a resource for health professionals providing care to international travelers. It compiles the U.S. government's most current travel health guidelines, including pre-travel vaccine recommendations, destination-specific advice, and easy-to-reference maps, tables, and charts. Next, we go to climate change. So what is climate change? It is one of the greatest health risks of the 21st century. So, over the last 50 years, the human activities, particularly the burning of fossil fuels, have released sufficient quantities of carbon dioxide and other greenhouse gases to trap additional heat in the lower atmosphere and affect the global climate. So, in the last 130 years, the world has warmed by approximately 85 degrees Celsius. So, each of the last decades has been successively warmer than any preceding decade since 1850. So, the sea levels are rising. Because of this heat, glaciers are melting and precipitation patterns are changing. Extreme weather events are becoming more intense and more frequent. What is climate change impact on health? Climate change affects social and environmental determinants of health such as clean air, safe drinking water, sufficient food, and secure shelter. So polluting energy sources and unsustainable transport systems also have large immediate and local health impacts, most notably the more than 7 million deaths that are caused each year by air pollution alone. Rising temperatures and more extreme weather events cost lives directly, increase transmission and spread of infectious diseases, and undermine the environmental determinants of health, including clean air and water, and sufficient food. Assuming continued economic growth and health progress, concluded that climate change is expected to cause approximately 250,000 additional deaths per year between 2030 and 2050. So 38,000 may probably be due to heat exposure in elderly people, 48,000 due to diarrhea, 60,000 due to malaria, and 95,000 due to childhood undernutrition. Additional impact of health. So, in extreme heat, so it may cause extreme high temperatures, which contribute directly to deaths from cardiovascular and respiratory diseases, particularly among elderly people. So high temperature also raises the levels of ozone and other pollutants in the air that exacerbate cardiovascular and respiratory diseases. Pollen and other aeroallergen levels are also higher in extreme heat and can trigger asthma. So ongoing temperature increases are expected to increase in this burden. Next, we have natural disasters and variable rainfall patterns. So globally, the number of reported weather-related natural disasters has more than tripled since 1960s. Every year, these disasters results in 60,000 deaths, mainly in developing countries. So the rising sea levels and increasingly extreme weather events will destroy homes, medical facilities, and other essential services. More than half of the world's population lives within 60 kilometers of the sea, so people may be forced to move, which in turn heightens the risk of a range of health effects, from mental disorders to communicable diseases. Increasingly variable rainfall patterns are likely to affect the supply of fresh water. So a lack of safe water can compromise hygiene and increase the risk of diarrheal disease, which kills over 500,000 children aged under 5 years each year. So floods are also increasing in frequency and intensity, and the frequency and intensity of extreme precipitation is expected to continue and intensify because of this. So the floods, as you know, contaminate freshwater supply, heighten the risk of waterborne diseases such as leptospirosis, and create breeding grounds for disease-carrying insects such as mosquitoes in dengue. So rising temperature and variable precipitation are likely to decrease the production of staple foods in many of the poorest region. So this will increase the prevalence of malnutrition and undernutrition, which cause around 3.1 million deaths every year. So in terms of infection, climatic conditions strongly affect waterborne diseases and diseases transmitted through insects, snails, or other cold-blooded animals. So changes in climate are likely to lengthen the transmission season of important vector-borne diseases and alter their geographic range. So malaria is strongly influenced by climate. So it's transmitted by Anopheles mosquito, and it has killed over 400,000 people each year, mainly African children under 5 years old. So the Aedes mosquito vector of dengue is also highly sensitive to these climate conditions. And studies suggest that climate change is likely to continue to increase our exposure to dengue. So why climate change matters to health? There is ultimate impact of climate change on our most precious resource, which is the human lives and health. Responsibility for protecting lives ultimately falls on the health sector. So investing in health resilience to climate risk can save lives both now and in the future. There is opportunity to promote policies that both reduce carbon emissions and improve health, particularly reducing over 7 million annual deaths from air pollution. The health sector has large energy demands, ensuring energy access for health facilities while reducing their environmental footprint, and can both increase climate resilience and significantly reduce global carbon emissions. What is the 2015 Paris Agreement on Climate Change? It is a legally binding international treaty on climate change adopted by 196 parties at the UN Climate Change Conference in Paris, France on December 12, 2015. It provides a framework for financial, technical, and capacity building support to those countries who need it. So the overarching objectives of this treaty is to hold the increase in the global average temperature to below 2 degrees Celsius above pre-industrial levels, and to pursue efforts to limit the temperature increases to 1.5 degrees Celsius above pre-industrial levels. So other recent goals include to limit global warming to 1.5 degrees Celsius by the end of this century. More and more countries, regions, cities, and companies are establishing carbon neutrality targets through zero carbon solutions. Remember that crossing the 1.5 degrees Celsius threshold risks unleash far more severe climate change impacts, including more frequent and severe droughts, heat waves, and even rainfall. So net zero carbon is important because reducing harmful emissions is the best way we can tackle climate change. So this Paris Agreement is a landmark in the multilateral climate change process because for the first time, a binding agreement brings all nations together to combat climate change and adapt to its effects. What are the initiatives? So who is raising awareness? So effective action on climate change and health requires the engagement of global health community and the support of the general public. So who is the one that provides leadership, evidence-based information, and training materials, and works with a range of partners to promote effective climate and health policy. So in strengthening partnerships, who leads the health components of the UN system-wide response to climate change? This includes representing the health in the UN Framework Convention on Climate Change, or UNFCCC process. So implementing partnerships such as the joint WHO-WMO Joint Office on Climate Information for Health and providing the health input into key cross-sectoral initiatives such as the Climate and Clean Air Coalition. Next is they enhance scientific evidence. So WHO leads, guides, and monitors research on the disease burden and the health costs attributable to climate change and effective interventions to protect and promote health. Lastly, implementing the health response. WHO applies its policy and technical capacity to help strengthen the climate resilience of national health systems and communities and to gain health benefits of mitigation policies. So here is something that we can do about climate change. So we need clean energy. Cleaner, more sufficient energy choices will go a long way to reduce carbon emissions. Sustainable transport. Instead, we should walk, cycle, and use public transport. This will clean the air, increase physical activity, and reduce additional disease like obesity. Next, we have sustainable food systems and healthy diets. Cutting down on red and processed meat and increasing fruit and vegetable intake in high consuming population will reduce emissions and diseases like cancer and heart disease. So I will leave you with a quote. Anyone who believes in indefinite growth on a finite planet is either mad or an economist. Here are my references.